Hi, my name is Annika Rule and welcome to my channel. I'm a registered nurse, licensed to work in New York and Florida, and I wanted to start a channel because there are two things I like the most: nursing and talking. Preferably talking to people, but those are two things I like the most. This is somewhat of an introductory video. I'm going to talk about a few topics that we may talk about on this channel. I also want to talk a little bit right now about the COVID-19 pandemic. I think we can go about without not talking about it or not acknowledging that we are in a pandemic. So I wanted one of my first videos to be about the pandemic. One of the things I'll talk about is changing from nursing school to being a nurse, or any career that you're having actually, because these tips are helpful for anyone from the college, from a college student to a new grad, and for the business world. We'll talk about many different topics. If you have something you want me to talk about, you could comment, reach out to me, and then we could strike a discussion about it. Alrighty, so once again, my name is Nurse Rule, and welcome to my channel. I think for my nurses, and anyone in the healthcare field and our essential workers. So that goes from those who work in the supermarket to those who work in transportation or shipping and logistics. I feel like we haven't gotten like a break really, in the sense that I know when COVID started last year, a lot of different fields at their employees actually go home and they took some time off to kind of figure out how we're going to handle this situation. And of my essential workers, we haven't really gotten that break, and it can be mentally exhausting. I know we have to take our breaks. I know there's a shortage and people are out sick in different circumstances. But I think one of the things is that we have to remember to just take care for our mental health. And that's something that we have to do. Apart from our adults, one of the things is our children. I do work with kids, a lot of kids from time to time in the day. And one of the things that I found is that our children, they're aware of what's happening. They may not know the big term pandemic, but they all know this is COVID. And they're sitting around them. They're wearing masks. They're doing schooling from home. For those who are going to school, there's so many restrictions. They can't eat lunch in the cafeteria as freely as they would want to. They can't go out and play, for recess. They have to walk in group, social distance, They have to be mindful of what they're doing. So it's affecting everyone on different levels. And depends on the country that you're in, or the state or the county that you're in. The restriction may be so different. And it's just one of those things where I always say to my patients, and it's not like we're trying to drive you crazy, and not like we're trying to have these crazy rules. We're trying to figure it out. It's one of those things that it's a worldwide, a pandemic. It's affecting everyone, and we're still trying to figure it out. And some countries may have done one thing, or state or county, that worked for them, and then another may have done it and didn't work for them. So I think one of the things that when we get all these different rules and restrictions, it can become exhausting, overwhelming, and frustrating, because we're only humans. But I do want to say that we should wear a mask, especially when you're out in public. Do practice social distance. It's something that we have to be mindful of. And I think in our daily activities in life, just to be mindful of our task and our activities. So back to mental health. And I was going to say, check on our kids. Whether you're an aunt, a mom, a dad, an uncle, a grandma, a grandpa, just a godparent, whatever it is, just check on our kids. And when I say kids, I mean all different age groups. I know recently I had a kindergartner, and he had said to his mom, no one is actually going to let me anymore because I have COVID, because he was tested positive for COVID-19. And when she said it to me, it really, really hurt my heart, because at that age, it's important for you to have friends and to, care about what your friends think about you. And for him to say something like that, I think that no one's going to like him because of COVID, it means that he's aware that COVID is something that nobody wants. It's not like something everybody wants to be happy about and go mingle with COVID. So it was something that I was so, it affected me in a way that I felt I had to talk to him. I just let him know that, listen, I'm your friend and I'm excited, when you come back, and when everything is okay and you can come back and we can see you. And it was one of those things that I would try to let him know that we're here and we miss you. And it's just one of those things as parents, how do you deal with that? Because how do you say to your child, no, that's not true. But also, too, keep in mind, like, if that child was tested positive and you were not tested positive, and it's one of those things where someone is probably going to wear their mask in the house. I mean, it's hard to isolate a child from their parent, but there are going to be difference in the house that the child will notice, and those things will affect that child. So it's exhausting, but it's also, we have to try to be creative with it and see what works for you. I would say sometimes, if it's just a child, don't let a child feel too isolated. Maybe everybody could just wear their mask instead of one person, and let a child wear their mask and you feel like, okay, he feels as though, or he or she feels as though something is wrong with me. Everybody could wear their mask, so it seems like it's the norm, or they won't feel so different than everybody else in the house. But also because our kids are home now and they can't socialize as they would. So that means that they are home, spending more time maybe on the internet, because naturally they're going to be online for school. So they're going to be on social media, and they're on a computer. So they're on a computer. Maybe you're not always going to check and say, is it schoolwork now? Because they do have assignments outside of the classroom or outside of scheduled class time. So it's one of those things for you just to know that TikTok and Snapchat are big right now. So everybody's going to want to do that, all those TikTok challenge. And we have to check on our kids, because it's affecting everybody. Check on them, they can't socialize as much as they want to, do activities with them if you can, because you still want them to be involved and socialize. It's just a matter of how you're going to do it, and be creative with it, and be safe and mindful with it. But it's just a few things like that. All right, so this is just an introductory video, and we talked about a lot. I'm actually going to make this one a little bit shorter than probably other videos, but I just wanted to talk briefly about that, because I think it's just something that we have to be mindful of, that we do have a lot of different effects from COVID-19, from mental to emotional to physical and to social and financial effects. So I did want to touch on that. Next week I'm going to talk about the vaccine, because I'm due to get my second dose. I got my first dose a few weeks ago, and I'll share how I felt after both doses. I'm not yet sure I'm going to feel the second dose. I've heard a few stories of how a few of my colleagues felt and friends felt, but I'm going to share that next in my next video. So once again, thank you for joining, or thank you for subscribing to my channel. And this is Nurse Rule, and we will talk soon. Be safe. Bye bye.